Good morning. I'm myself Dr. SUDEEP, Professor and Head of the Department of Prosthodontics, PMS College of Dental Science and Research. Today, we'll have a talk on dental veneers. I'll just go through some of the important points of dental veneers in the clinical scenario. First, we'll come to the definition of dental veneers. A veneer is a layer of tooth-colored material that is applied to a tooth to restore localized or generalized defect and on intrinsic discolorations. Typically, veneers are made of directly applied composite, processed composite, porcelain, or pressed ceramic materials. When we come to the indications of veneers, there are many indications where veneers can be used as a treatment option. It is used for discolored teeth, such as in tetracycline staining, fluorosis, devitalized teeth, and teeth darkened because of age. Then it can be used for chipped or fractured teeth, where a repair can be done with veneers. When we come to the contraindication of veneers, if little or no enamel is present, full crown should be considered. In that condition, where veneers are not used as a treatment option. Certain tooth-to-tooth habits like bruxism or clenching or other parafunctional habits such as pencil chewing or ice crushing is totally contraindicated for veneer treatment. If there is severe crowding where the tooth, especially the anterior teeth, if there is severe crowding on the anterior teeth, this veneers cannot be placed on such type of patients. And certain types of occlusal problems where the patient is having a class 3 or end-to-end bites, or where there is an interference on lateral, or sorry, on for on in on when the patient moves the mandible towards forward, if there is an interference, this veneers cannot be considered. Next is if the patient is having a poor oral hygiene, it's better veneers should not be given to such patients. And in high caries, if the patient is having a high caries index or high caries rate, this cannot be considered. When we come to the different types of veneers, it is based on extent of tooth involved. There are basically two types of veneers. That's a partial veneers and full veneers. In full veneers, there are many preparations such as window preparation, butt joint incisal preparation, incisal lapping preparation, and all. For partial veneers, these veneers are indicated for restoration of localized defects or areas of intrinsic discoloration. Full veneers are indicated for the restoration of generalized defects or areas of intrinsic staining involving most of the facial surface of the tooth. When we come to the basic preparation designs for full veneers, there are two types, basically window preparation, incisal or lapping preparation. Window preparation is recommended for most direct and indirect composite veneers. This you can see in the picture, there's a window preparation. And this intra-enamel design preserves the functional, lingual, and incisal surfaces of maxillary anterior teeth, protecting the veneers from significant occlusal stress. In this, we can see the enamel is this veneer is the preparation is designed such as the anterior incisals on the anterior surface in this is involved, and none of the occlusal stress will not interfere in this type of preparation. By using a window preparation, the functional surfaces are better preserved in enamel, because in this you can see this is the functional these areas are the functional, because this is the which we see outside, that's when the patient smiles. So this is used, this type of preparation is used for a better preservation of enamel, and less enamel is moved or disturbed during the preparation. Second is the incisal lapping preparation, where the incisal ankle or the surface also is involved in this. It is indicated when the tooth being veneered needs lengthening or when an incisal defect warrants restoration. This design is used frequently with porcelain veneers because it is not only facilitates accurate seating of the veneer on cementation, but it also allows for improved aesthetics along the incisal edge. Here, the incisal, you can see in this picture, the incisal edge is also involved in this incisal lapping preparation. When we come to the different types of preparation in window preparation, the advantage is it retains natural enamel over the incisal edge. And the advantage is the incisal edge is weakened by the preparation. Aesthetically, it's not pleasing as the margins may be visible. Next is a feather type of preparation. There's a guidance, or there's a guidance on the natural teeth. It can be maintained. So the veneers will be more it can be it is maintained in the mouth. So the veneer, the disadvantage of this is the veneer is fragile at the incisal edge and can get dislodged during protrusive movements. Next is a bevel type of preparation, more control over the occlusal and aesthetics is more, we have a better control of on aesthetics and provides a positive seat for a better or veneer placement. And here, the disadvantage is more extensive to reduction is required. The incisal overlap provides the type of preparation provides a positive seat for the looting of the veneer. The more and the disadvantage is more extensive tooth preparation is required in this type of preparation. When we come to the different types of material employed in this type of veneers, is there are direct applied composite veneers is used, processed composite veneer is used, porcelain or pressed ceramic veneer is used for as a veneering material. Found based on a mode of fabrication, direct veneers is a direct partial and direct full veneers are used. For indirect veneers, there's a no prep veneers where less amount of or no preparation is required for the teeth. So etched porcelain veneer and pressed ceramic veneer. When we come to the composite veneers, there are a lot of advantages, and like this, more disadvantages also seen. Advantages are the one the patient is having a less visit procedure. Only one time the patient visit, we can do a composite veneer, and this when we compared with the ceramic veneer is less expensive, and we can do any repair. Even if a failure happens also or a fracture happens, we can do a better repair on this type of composite veneers. Then we have a chair side control of the anatomy when we do the carving. We have a, because it's not sent to the lab, we do it in the clinic. So we have a chair side control of the anatomy of the tooth, and minimal irreversible loss of the tooth structure happens when we go for this composite veneers. Disadvantage of this is there are chances of discoloration. Then it wears out very quickly. It wears out. The marginal staining is seen in this type of veneers. Shade matching is little bit difficult when we go for this type of composite veneers, and often require repair and replacement of composite veneers. When we come to the conventional porcelain veneers, it's a very conservative preparation, offers better inherent color and natural look, and tissue tolerance is excellent. There is less staining, and the bond of etched porcelain veneer to enamel is stronger than other. Wear and abrasion resistance is high, and aesthetics are better than any other veneer material. It's the disadvantage is expensive tooth preparation, highly sensitive technique, and sensitivity test numb, and many limitations. When we come to the conclusion, this procedures become more common in dental office, because nowadays many people want more beautiful smile, so they come for this type of operation. So thank you for your patient listening, and now we will come with a new topic. Thank you.